Alright, in this video we're going to take a look at how to correct the H's and T's. We'll also go over a quick review of what the H's and T's are and essentially what we can do to manage them. So first things first, the H's of ACLS care are hypovolemia, hypoxia or hypoxemia, hypo and hyperkalemia, hydrogen ion acidosis, and hypothermia. The T's of ACLS care are tamponade, toxins, tension pneumos, and then pulmonary and cardiac thromboses. So when you look at the H's of ACLS, we want you to remember VOCAT, V-O-K-A-T, and we should preface this by saying always follow your local protocols. So the first V of VOCAT I want you to look at is hypovolemia. So with hypovolemia, you're going to look for signs of tachycardia, a narrowed QRS, and then blood loss, which can be obvious or suspected. So our treatment for hypovolemia is typically going to be centered around replacing fluid levels, keeping the patient warm, and transporting them to the hospital. Second is the O in VOCAT, and that represents hypoxia and hypoxemia. The signs and symptoms of these things can be bradycardias, cyanosis of the lips, fingers, toes, and ears. And the treatment is providing oxygen and helping them ventilate if they aren't doing it for themselves already. So good bag valve mask ventilations, high flow oxygen, pretty self-explanatory on this one, but we want to make sure we're doing the basics very, very well. The K in VOCAT stands for hypokalemia and hyperkalemia. With hypo or low potassium, we're going to see flat T waves and a possible U wave. We'll look at some EKGs here in a second. We're not really going to have much to do in the pre-hospital setting in terms of treatment for this. It's one of those more difficult ones that they have to draw some blood labs on to confirm and then give IV potassium. Some protocols will allow for lactated ringers to be given if that's in their suite of drugs that the agency uses. And then hyperkalemia or too much potassium, you'll see peak T waves, wide QRS, and we'll go over an EKG with that in just a second here. Treatment is going to be, again, it's going to vary depending on your protocols, but people will see sodium bicarb as a treatment, calcium, IV calcium, long-term NEBs to kind of pull the potassium back out of the cells and into the bloodstream. And we'll go over those EKGs here real quick. Okay, so first with hypokalemia, we're going to see flat T waves. So you can see these are relatively flat in a few of these leads. And then you're also going to notice the potential for a U wave. And the U wave is popping up in a couple spots. But again, this is kind of difficult to see because this is a physical tracing over a really light ECG that we had found. And then with hyperkalemia, again, you're going to see stages of hyperkalemia, but you'll see these tall peaked T waves, and these are pretty pronounced. These are letting you know that this is maybe beyond the initial stages of hyperkalemia. Next, you'll go and see, with hyperkalemia, you'll see a widened QRS and a lack of a sinus P wave. And this is going to be a later sign of hyperkalemia. This has been going on for a while, and it's really starting to affect this person's ECG rhythm. So the A in VOCAT is acidosis or hydrogen ion excess. And so we'll see a low amplitude QRS complex. And again, treatment for this typically going to be supportive care in the pre-hospital setting, but you can see that these QRSs are pretty low in terms of amplitude. They're about just over a box, nothing too large there. And you can also see that this rhythm is a little bit irregular, which is also common to see arrhythmias with hydrogen ion excess that has been going on for a while, starting to affect the ECG rhythm. And lastly is the T in VOCAT, and that stands for hypothermia. And so with these, you'll get, obviously, you're going to have someone that's been in a cold environment for a very long time. You want to get them out of that environment, warm them up, cover them up in blankets, and then make sure that you do that in a controlled manner that isn't, going to warm them up too quickly, because that can cause problems in and of itself. But one of the things we're looking for on the ECG with hypothermia is what's called Osborne waves, and that are these little bumps here at the end of the QRS. So the treatment for this is, like we mentioned, get them out of the environment, give them some dry, clean blankets to keep them warm, and do that in a controlled manner so that we're not doing it too quickly. All right, moving on to the T's of ACLS. I want you to remember in mnemonic TAM, TOX, TEN, THROMB. Again, always follow your local protocols, but this information will help you kind of clue into some things that you can do with your treatment of the H's and T's. So first, TAM, so that's cardiac tamponade, and the signs with this are Beck's triad, tachycardias, JVDs, muffled heart tones, and low blood pressure, and look for a narrowed QRS. Treatment for this is going to depend on your local protocols, and most often we're going to be treating with some fluids, making sure that we get the BP in a stable zone right around 90 systolic. We'll be checking heart tones as well as providing supplemental oxygen and getting them to the hospital as quickly as possible. Tox is next, or toxins. And with these, we're looking for a prolonged QT interval, or something that the patient has ingested that is potentially causing a elongated QT interval. So here's the start of this QT here, or the Q wave here, and here is the T wave. That is obviously a lot larger than it should be. Looks like it's about 3 boxes, and we want to see that under 2. And I'm talking about the big boxes here, obviously. Next is TEN, or tension pneumothorax, and signs there are bradycardia, and look for a narrowed QRS. You can have unequal breathing, JVD, and tracheal deviation is a late sign. But with these, we're looking to provide supplemental oxygen and then decompressing the chest once it's developed from a pneumo to a tension pneumothorax. And be sure to check out our video on tension pneumothorax management as well. And lastly is THROMB, or thrombosis. Again, we have pulmonary and cardiac, so we'll go over both here. You have tachycardia, primarily just due to the heart trying to work harder to get that little bit of oxygen it has left around to all the parts of the body that need it. You'll look for a narrowed QRS. We typically won't see wide QRSs with these rhythms. That's more of a late sign where some bad things have already been put into play for quite a while. You'll see shortness of breath, low oxygen saturations, and even chest pain if the patient's conscious and can complain of anything that might actually point to where they're feeling pinpoint type chest pain. And with this, we're doing supportive care. We're doing pain management, providing supplemental oxygen and ventilations if need be. And we're potentially providing some fluids to keep their blood pressure at a healthy rate, and to mainly get them the oxygen they need so that we can at least support them en route to the hospital. And lastly is the coronary thrombosis. You're going to see a wide range of abnormal ECG findings here. This one is obviously showing a 12 lead of an MI going on. You see lots of ST elevation, which obviously signifies injury and infarct to the heart. And looks like this provider also circled the fact this is a left axis deviation, just again supporting the fact that they're probably looking at a MI. Lots of things you'll see here with coronary thromboses, but treatment is going to be typically pain management, supportive oxygen, nitroglycerin if it's in your protocols, as well as providing aspirin as early on as possible.